He looked me dead in the eye and said, "Doc, it tasted awful and it was really hard to swallow." And I stared back at him and I looked at his chart and I was like, what was so difficult to swallow? He replied with the stone-cold confidence of a man who followed every instruction to the T, the suppository you prescribed. You know, the little torpedo-shaped pill. It took every ounce of my professional composure not to drop my pen, look up at the ceiling, just ask the universe for strength. I'm Dr. Schehrezade, your Doctor Bestie. I'm a board-certified internal medicine doctor with over 10 years of experience, and I've seen things in medicine that will make you laugh, cringe, and maybe even question your own understanding of common sense or basic anatomy. Now, don't get me wrong, medication errors are no joke. They are a huge cause of preventable harm in healthcare all over the world. But today I'm going to talk about the most embarrassing, cringeworthy, downright dangerous patient stories to teach you. My goal today is to make sure that you are not the bit of a joke like your doctor stories. So let's start with number one, the suppository situation. The man who ate his own suppository.
It's time for the pill!
This gentleman, I'll call him Bill. He came in with severe constipation and he was in a ton of discomfort. I prescribed a standard laxative suppository. For anyone who might not know, a suppository is a small, solid medication designed to be inserted in the rectum, and once inside, your body heat melts the outer casing and releases the medication right where it needs to work. It's actually a fantastic delivery method when you can't take medicine by mouth because of nausea or you just can't swallow for whatever reason and you need a localized effect. So I explained this to Bill, or at least I thought I did, and I told him to take one when he got home. The next day he calls my office and he's furious. He said the medicine wasn't working and that it was the worst tasting thing he had ever eaten, and that it was a miracle that he hadn't choked on it. There was a long, silent pause on the other end of the phone, and then the puzzle pieces clicked into place.
Whoa!
He had eaten it. He chewed and swallowed a wax-coated laxative torpedo. After I managed to pick up my jaw off the floor, in my surprise, I very gently explained the route of administration again. The silence on his end was even longer than the silence on my end, followed by a soft, oh dear. The good news is that besides a terrible taste and a total lack of relief for his constipation, he was fine. But the whole thing highlights how important communication is, especially in healthcare. Medication errors are incredibly common, and a major cause is just a simple breakdown in communication or misunderstanding. The lesson? Twofold. As a doctor, clearly verbalize, write down, and ask back for what the instructions are. And as a patient, if you're not sure how to take the medication is, whether you should eat it, swallow it, put it on your skin, or tape it to your forehead, ask your provider or your pharmacist. Ask them to draw a diagram. There is no such thing as a stupid question, especially when it comes to your health. But swallowing a suppository, that was pretty close. And that's why the internet does exist. We used to have patient leaflets where we'd hand pieces of paper to patients, but now everything is online. So if you're ever curious, look it up, ask somebody. And a suppository is something that's inserted into the rectum and you lie still for 15 to 20 minutes to give it time to work. Let's move on to our next story, which I've fondly named the yeast infection. There is a young woman, we'll call her Sarah. She came to see me with a raging yeast infection. She kept saying, "It's so itchy down there." She was miserable. I could see it all over her face and I really felt for her. I wrote her a prescription for diflucan, which is a very common and very effective antifungal medication. It's a single pill, a one-time dose, you swallow it, and it works systemically to clear the infection. It's simple, right? I told her, take the pill and you should start feeling better in a day or two. She nodded, took the prescription paper, and left. A week later, she was back and angry. The infection was worse, and even more, she was super uncomfortable. She told me the medication was impossible to use. And I was like, impossible? Because it's just one tiny small pill. So how could it be impossible? So she looked at me and was like, first of all, it doesn't stay put. It's not a cream. So how can a dry little tablet stay there? I tried crushing it. I tried getting it wet, but no matter what she did, she said it kept falling out. I didn't even know what she was talking about. It took me a few seconds to catch up. And my mind was doing mental gymnastics trying to figure out what she meant. I kept thinking, mash, like she was taking one of those cooking things and mashing up what was she doing? And then I realized she had been trying to put the oral antifungal tablet directly into her vagina, which is like very opposite of what the first guy did. But I didn't realize that that wasn't common. So we sat down, we talked about it together, and unfortunately, doing that, she had likely increased the risk for more bacteria and flora to enter that irritation area. So that made the whole situation a lot worse. And we had long conversations about the difference between oral and vaginal routes of administration. I understand it's a common point of miscommunication because medications come in both forms. The lesson, learn about the routes of administration, ROA, routes of administration for medication. They're not interchangeable. Like oral pills are designed to be broken down by stomach acid and then absorbed into the bloodstream. Vaginal suppositories or creams are made specifically for the environment of the vagina. Putting a medication in the wrong place will hopefully not do no harm, but could cause serious harm or new infections. So when you get a prescription, follow the instructions to a T. And if you're not sure, ask. Pay very close attention to the words, they're not suggestions. If you're finding these stories as wild as I am, maybe learning a thing or two, do me a favor and hit that subscribe button. We talk about all things health related here. I'm your friend in medicine, and I promise it is not always this cringeworthy. Well, mostly. Next, we get into one that maybe not be that funny, but it can be dangerous. It's a simple medication. So it was an elderly patient, let's call him George. He had just been discharged from the hospital and he was sent home with a whole new set of medications, including a new blood thinner. Blood thinners are high alert medications because errors with them can carry a high risk of serious harm. The hospital doctor gave him a new prescription list, and me, as his primary care doctor, was also sent the list. Well, George was confused when he came to see me. Post-discharge, he was a good patient, so he came to see me as a hospital follow-up, and he was like, I'm really dizzy, I have all these bruises. And then I reviewed the list from the hospital, and I asked him to bring his medications with him because if you've been one of my medical assistants, you know I want patients to bring their pills. He brought his weekly pill organizer, but also the bottle. That's where I saw it. Each medication had been in there twice, and he was taking doubles the amount of medication. So when he was discharged from the hospital pharmacy filled all the medications, gave them to him. And then when I received the discharge medicine reconciliation, I prescribed those for the patient so he didn't miss a day. So he went to pick up those new pills thinking they were refills. Every single day, he was taking double the dose of amount of medication, including the blood thinner and this kind of thing. Sadly, but is a terrifyingly common scenario because communication errors between different healthcare providers, hospitals, specialists, primary care doctors are a huge source of medication mistakes. George wasn't doing anything wrong. He was caught in the middle of a crossfire, complicated system. We immediately fixed his doses and thankfully he was okay, but it could have been much, much worse. The lesson? You are your best advocate. You are the one putting the pill in your mouth. You are the one looking at the medication's names on the bottles. If you take really good care to look at the names of medications, write them down, keep one single updated list of everything you take. Prescriptions on the top, over-the-counter supplements, drugs, vitamins on the bottom. Put the doses and put how many times a day you take them. Anytime you see a provider, if you get hospitalized, if you know you're gonna get hospitalized, if you know you're gonna have surgery, have that list with you. And on the top of that list, put the date for when you updated it. When you see your doctor after a hospital visit, you'll want to bring your old list and your new list or bring all the pills and do what we call a medicine reconciliation. A reconciliation is let's go through what we thought you were on, what you should have been on, what you stopped and why. And so the conclusion is from suppositories that went on a surprising journey all the way to pills that ended up in the wrong hole. We've all been through wild scenarios, and while we can laugh at how absurd these stories are, they share a common theme: miscommunication and medication errors. These are preventable causes of harm. Just because patients are embarrassed doesn't mean it's too silly to ask a question. And I want to be crystal clear here. There are no medical questions too embarrassing to ask. Every time someone asks me a question, I do my best to say, thank you for asking. I promise we've heard it all. And the most important thing you could do for your health is to be an active participant in your own health. Be active, be involved, don't be passive. Passive patient will have more errors. Don't be too controlling and overly directing traffic because you didn't go to medical school, but the goal is to keep you safe and healthy, and that starts with clear communication. Now, I want to hear from you. Share your own anonymous stories in the comments below. Let's normalize these conversations and learn from each other. And if you learned something today, please give this video a like and subscribe for more content that helps you stay in control of your health. Own your health, own your future, and for the love of all that's holy, please do not eat your suppositories.